Hello, this is Charles Reynolds, and thank you guys for showing up. I think that it's useful to start off by just talking about why we're here. I don't pretend to have the end all, be all, cure all. I don't think that what I have takes the place of sex education. I don't think it can cure every medical problem that can cause or psychological problem that can cause sexual dysfunction. But I think it's important that for you to know about it because I do think it's a breakthrough. It was actually shown to me by a woman. I actually stumbled upon this by listening to a woman. I just happened to be in the right place at the right time. I don't pretend to be smarter than anyone, but I happened to stumble on this. It is changing people's lives, and it's come to the point after doing this procedure now and teaching it to 40 doctors and doing it over the past 2 years. I, I almost feel morally obligated to make it my obsession until it's more widely known. And I know you guys know this, but I think it's useful to start off on the same page by realizing how important sex is. We all know that just by talking about sex, even in these modern days, so-called modern days, that just by talking about sex, it puts you open for being attacked as a physician, as a psychologist, as a family therapist. We all know that people still, heck, in my state of Alabama, people are still arrested. They still enforce the law of arresting store owners who sell a vibrator for sexual purposes. True fact. A few years ago, someone was arrested. They have to put a label that says for novelty use only. Emerson called sex the scaffolding of love. Raina Maria Rilke spoke about it as being related to the creative experience. Napoleon Hill, in his classic Think and Grow Rich, talked about it as a source of energy for prospering financially. Of course, it's very important to our happiness machine, the family. And a study published in JAMA in 2009, I think it's just to remind everybody, this is a quote from that study: sexual dysfunction is a serious psychological phenomenon associated with low personal and relational well-being, and it's worse for women. And that study, as you guys know, went on to point out the fact that it's actually more common in younger women, unlike what most people seem to think. Now, there I have here, I'll come back to this presentation, but I want to go to this. I think this is a very nice review by MD and PhD about the female sexual pain disorders. And in this review, they talk about the studies trying to quantify how many people actually have this problem. And the range was from anywhere from 0.4% to 61% of females. So why such a wide range? I think this helps answer that question. If you look, and these numbers are directly from a practice review bulletin from Obstetrics and Gynecology, the Green Journal, which the gynecologist is like the New England Journal for Gynecologists, as you guys know. And this is directly quote word for word from that practice bulletin or their review of how to take care of females with sexual dysfunction. And the numbers you see, there's a range there, but um, if you look at the strict definition, to be counted in this number, the woman has to be having distress. If it is not bothering her, then she drops off the, the chart as being counted under the strictest of definitions. So if the woman, for instance, has dyspareunia and she starts to avoid relationships and starts to live alone and becomes content without masturbating, without having a sexual partner, and that ceases to be a form of distress to her, then she is no longer counted as having dyspareunia. And I think you could argue that perhaps in many cases she should be counted because she's retreated to a place of learned helplessness, and so for that reason has adapted without that part of her life. And I find this tragic. I wouldn't stop counting someone as having hypertension just because they quit being bothered by it. So that's an important point to make, I think. Now, this story, I think, points out why this procedure is important. First of all, the way I came upon this, sort of who I am, we'll come back again to this. Let me give you a little bit more background about who I am in case you don't know. There's, if you go to here and just Google um, If you look for vampire facelift, this is my trademark and my invention. And it came out of another thing that I was doing. I was early in, before Suzanne Summers wrote the first book on hormone replacement, I wrote a little book called, um, well, I'll just show you, called Anytime for as Long as You Want. And where this book came out, and it's for 3 years from 2004 to 2007, it was the best-selling sex manual on Amazon.com. Now, this book actually came out of frustration. I was doing research with hormone replacement again before it became popular in '99, 2000 through 2003, with Genotropin, which Pharmacia owned at the time. They sold it out to Pfizer. And I developed a large practice of mostly women. I did hormone replacement for over 3,000 women before it became cool. And of course, in the process of doing that, I spoke with literally thousands of women about their sexual function. I'd have to be stupid not to learn something. So out of that, I had so many women becoming healthy and then being frustrated with the inability of their lover, if it was a man, that I wrote a book to give to my patients to take home to their male partners to help them catch up. It was basically a health book disguised as a sex manual to help them come back. So I had this expertise with sexual function that just came out of being at the right place at the right time. And then not on the level of a sex educator, but at least as far as a physician. And then out of that, as the women were losing weight, they started complaining of their face collapsing and they didn't want to lose weight because their wrinkles were showing up. So I developed an expertise in cosmetic medicine. So I had these two things going on, and someone approached me with a new way of helping rejuvenate the face. And that new way is called platelet rich plasma. So if you go to and you look at that website about the vampire facelift, what I'm doing there is I'm combining platelet rich plasma with hyaluronic acid fillers, and in that process, rejuvenating tissue. So I'll come back to that research in a moment, and there is a mountain of research. But let's think about a patient, because this is what we're really after. Consider this. Um, a woman, 36 years old, she's having difficulty with orgasm. Previously, she reported to me she actually was a sex addict, but she literally had physical abuse by her husband, to the point genital physical abuse that left her with scar tissue and difficulty having an orgasm, as you might imagine, for more than one reason, and true dyspareunia, and some stress incontinence, but normal, healthy lifestyle and normal hormones, and on no medicines. Young woman in her late 30s with a 6-year-old child. So, what do you do for this woman? There are topical things that you could do, there are psychological things you could do, but what could you do to help actually rejuvenate the vaginal tissue and help her with the healing? She'd been to multiple gynecologists. Okay, so let's think about that patient and then come back to my story. So, using these growth factors, and by the way, I'm going to show you where you can see my review of the medical literature for those growth factors. If you go to my last name, Runnels.com / and then capital PRP, which stands for platelet rich plasma. My last name, Runnels, RUNELS with one N.com, and then PRP with capital letters. You'll see here a lecture that I presented at a symposium about platelet-rich plasma and all the studies as relating to rejuvenating of tissue, collagen, fatty tissue, every cell type. Basically, I'm creating by a centrifuge, isolating platelets, activating those platelets, and then the growth factors are released, causing the unipotent stem cells that are in that tissue to replace the tissue. Think of it like the yellow goo that's around a scab if you scrape your knee. Everybody remembers that as a child. That yellow goo is a balm that's created by the platelets that causes tissue to rejuvenate itself and grow the new skin. You don't get a new piece of skin from the store. The doctor doesn't give it to you. You have to grow it. And that growth is stimulated by the platelet release growth factors. So for at least 10 years, the orthopedic surgeons have used it, the oral surgeons have used it, a lot of research in the wound care literature. This is a video of this young female who had a horrible ankle scar that I treated using that same technique. So in the process of doing this, what happened was I had a lover whom I had treated her face, and she loved what it did. And we were actually going out to dinner on her birthday, which happened to be April Fool's Day in April of 2010. And she said, "I want that in my vagina." She said, "I have delivered 3 children," which she had, "and I want to see if that does for my vagina what it's done for my face." And so I injected her vagina, and the next morning she was hypersexual. And I think that was probably from simply the pressure effect of the fluid because there wasn't enough time for the cells to actually rejuvenate. If you look at the anatomy here, where I put the injection is actually between the urethra and the vagina. The platelet rich plasma goes there, so I don't even need a speculum. The 27 gauge needle goes right there. And by the way, a needle in that area is not enough to cause any permanent damage. People drain the bladder with needles larger than that. You can take a needle that side and put it in the carotid artery without any damage. So the needle isn't a problem. And the material itself has been used for at least 15 years in all these other areas of medicine with never, ever, not one reported serious side effect because it's the person's own blood product. It's not an actual medicine that you can have a reaction to. So back to this woman, after my lover had that experience, I called this woman whom I knew had these problems and I injected her. And she literally had a callus on her clitoris where she was having trouble having an orgasm. And I'll get to what happened to her in a few moments, but I think it's useful to come back to the literature. Conservatively, somewhere around 3 out of 10 men and 4 out of 10 women have some sort of sexual dysfunction, much of it being dyspareunia. And only 14% of women ever in their entire lifetime have a conversation with their doctor about sex at all, with doctor as in their MD doctor. Now, here's some of the things that have been injected and talked about recently. Using calcium hydroxyapatite, that's the same as Radiesse. You get granulomas with that. But this journal article in Obstetrics and Gynecology reported that even with the granulomas, it helped urinary stress incontinence. And collagen has been injected in that area. Dr. Matlock came up with this procedure with Juvederm. It's basically, he calls it collagen, but it's basically a orthopedic version of Juvederm. It's a hyaluronic acid filler that can also cause granulomas. So every material that's been injected there has had a problem. If you go back to that book that I was showing you there, they do a very nice job of reviewing um, well, I lost the book, but you saw it. The same authors of this book did a book for physicians, and they do a very nice job of reviewing the different materials that have been applied topically or injected. Nitroglycerin, lidocaine, an extract from chili peppers that's often used in pain. Well, lidocaine in the chili pepper extract causes numbness. Who wants that? There's hormones, but if the woman's hormonally normal, that's not as helpful, and there's some danger to women who've had breast cancer. There are topical TCAs or trichloroacetic. You can use tricyclic antidepressants and some of the gabapentin or the anti-epileptics. But I mean, again, who wants to have those potential side effects? Corticosteroids, which could cause more atrophy. All those things have been applied topically or injected. Interferons, but platelet rich plasma, I'm not sure why that's been overlooked. But if you review the literature, and it's a huge amount of it, again, that has um, that has no reported side effects ever. I don't know anything else with that history. So let's talk about some of that literature again, and then let's get to how this can actually work for you and your patients, what to do, and how to become involved in our clinical trials. Here are some of the growth factors released from platelets. This is a study showing that those growth factors remain there after being injected for a week or so at least. But think of it like fertilizer for the stem cells, and those stem cells are going to grow a new healthy tissue. This is an in vitro study looking at the same things. So it stimulates stem cells, fibroblasts, collagen, and new blood flow. And this is from biopsy studies in the back of the arm and other places. But no one's ever done a biopsy study yet in the vagina. Again, there's no reason if it works in the face, in the joint, in the skin, even post hysterectomy and post facial plastic surgery or post laser. There's no reason to think it might not work. Here's some more of the studies. These are biopsy studies showing that the new angiogenesis, this is using it in the breast to rejuvenate new breast tissue. So we have this new form of not a new form, we have an old form of rejuvenating tissue, and this is just an idea of using it in a new place, right there in the between the urethra and the vagina with a very superficial injection. Now think about what happens. You have Skene's glands, which we now know produce some of the fluid that appears when women ejaculate, and I do have women that are ejaculating for the first time, both in my practice and the other 40 or so doctors' practices that are now doing this procedure. You have rejuvenation of those glands. And now imagine, this is anecdotal, but if the sex drive is somehow related to congestion of say, seminiferous tubules, why wouldn't the Skene's glands, which also produce a fluid that's positive for PSA, somehow contribute to a neurological response? As you know, Dr. Grafenberg, for whom the G-spot is named, thought the urethra was the most erotic part of a woman's body. So rejuvenating that area does seem to help with libido. Again, I do not think this shot takes the place of sex education. Nothing does. Nothing. The biggest, most important sex gland is between the ears. We all know that if that is not straight and if people don't understand on a different level what they're doing, then they won't go to a different level when it comes to the mental, emotional, and even spiritual effects of practicing sex. So there's nothing that takes the place of good sex education, which is why I'm very passionate about making sure sex educators actually take a lead in bringing this procedure out. I don't want physicians just jacking people up with shots and sending them out the door thinking this magic shot's going to cure all their problems. Back to what happened with my patient who had this shot, who had the abusive husband, she did in fact have her dyspareunia resolved. She dumped the old boyfriend, the boyfriend she had when I saw her, and within 3 months was engaged to an old lover whom she had not. She'd actually avoided him because she didn't feel like she could be a good lover to him, whether that's right or wrong. She thought her pain and avoidance of sex made her unfit. She called him up, they became engaged, and now they're married after a shot that took me 10 minutes on her lunch hour when she walked over from the bank. Now, how can how how can you become involved? There's a protocol. We're doing a clinical trial where we would like to involve both sex educators and physicians. We think this is a game changer. We want to um, invite you to participate, and I want to show you where you can go to do that. This, by the way, is the website where we try to educate patients. And you can see here, this was on the doctor show. One of our lead physicians was there talking about it. Here's me talking about some of the literature. If you go here, you can see research that is relative both in other branches of medicine about how platelet-rich plasma develops and his work. This is a video of me talking about that research. Here's those practice bulletins. And here is where we list providers. This website, by the way, gets about twice the traffic of Botox.com with only about 40 something physicians listed here. And I think we only have about 4 sex educators. Okay, 6 sex educators listed here. And so this is not something that's going to make your phone ring constantly, but it will make your phone ring. And all we're asking of sex educators is that they know about the procedure, refer people who are appropriate think about this just as a way to rejuvenate vaginal tissue with very low risk. I hate to say zero risk, but again, in all the medical literature, there's no documentation of anyone ever having a serious side effect from platelet-rich plasma. And of course, the women teach me about things by just listening. My lover taught me that this might be something good to try, and the second woman whom I injected happened to have stress incontinence and told me it resolved. And I'm thinking, duh, Charles, why didn't you think of this? Because again, that's what people have had in mind for most of the time they've been injecting around the urethra with various materials, trying to to treat stress incontinence, and I have yet to have a failure. Of course, this is not going to take care of a dropped bladder. It's not going to treat endometriosis. It's not going to make a woman suddenly want to have sex who was abused as a child. This is not a magic shot. On the other hand, if a woman has atrophy or or PRP or platelet-rich plasma is used to treat scar tissue with great effects in other parts of the body, as you'll see when you see the literature that I have here. So there's no reason why it shouldn't help in the same way in women who normally might have a mesh that's gone bad or a childbirth that left her with scar tissue. We are indeed seeing very good results. So how to become involved? If you go to oshot.info /a member /sign up, oshot.info /a member /sign up. I have here for a sex educator to pay $1. I mean, that's lifetime. I basically want to make sure that someone in your neighborhood isn't trying to make it look like you're interested when you're not. This is just a way basically to use your credit card to prove your identity. Once you do that, you're onto a website where I have videos of the procedure, have about 4 hours of lectures that you'll know most of what's there, but at least you can confirm that we're thinking similarly. You may know, I'm sure you'll know things that I don't talk about, but it's just a way to make sure that we're on the same um, wavelength. Once you see those materials, if you see that this is something that you would like to participate in our clinical trial, by referring people, helping us gather data about the response to it, and to be listed here as one of these sex educators, then you just send me an email, and for no extra money at all, nothing, I will list you here as an educator who understands how this procedure works, so that then you can have physicians referring to you and you referring to physicians. So that's it. I'll show you again. You would just go to type in your browser here, oshot.info, a member, all one word, sign up, and then push that and you'll be there. And then you would push on sex educator for $1, put in your name, sign in. If you have any questions at all, my cell phone is actually on the website, but I will give it to you right now. It's 251. This is my personal cell phone. If you're on this call, you deserve to, and you're considering talking about this with your patients, you deserve to be able to call me. And I should consider it my obligation to talk with you and answer any questions that are not answered here. I would ask you to at least look at the materials to get an idea about what's going on before calling me. My number is 251 648 7704. You're not going to pop up as a provider by just paying this buck and going looking at videos. Again, that's just to make sure you are who you are and not someone who's trying to sabotage the whole thing. I've had trouble getting industry to actually participate in helping us. These kits, by the way, are FDA approved. They are FDA approved to prepare platelet-rich plasma in a sterile fashion and have been used. Most of them were FDA approved to use in the orthopedic suite because that's where all the business is. This is they wouldn't go through millions of dollars to prove it for this procedure because this is a new procedure. But it's like a suture. A suture is a device that has to be FDA approved to be sterile and hold the skin together. But the FDA does not tell the doctor what to do with it when he's in surgery. So the FDA has jurisdiction over devices and drugs, but not over the way a procedure is done or what procedures are done with that device. So using blood-derived growth factors can be done in various ways as I mentioned, after laser, after orthopedic surgery, after facial plastic surgery, and people are and do use that many thousands of times per day in this country already, but it's not being used. People are still getting jacked up with Juvederm and Radiesse and collagen and meshes, much more dangerous things. It makes me shudder to think about people being injected with anti-epileptic medicines or antidepressants or numbing medicines when there's something with zero risk the best we can tell, if it causes a risk here, it'll be unlike any other part of the body. So far, it's caused no problem. This is what the body would make. If you did a mesh surgery on the vagina, platelet-rich fibrin matrix is what the body would make to recover from that surgery. So anyway, when the physician does this, they are doing a procedure that is not even the FDA's business. But a physician who does this should be using an FDA approved device. So the reason for this trademark and this website is I don't want people out there jacking people up. There are physicians who will try to save a few bucks because these tubes, the kits cost several $100s. And so, but you can make it homemade for a few dollars, but then you're not using an FDA approved device. You could have infection, you can have all sorts of horrible things happen if you don't keep a sterile technique and have an FDA approved device. So the purpose of this trademark, OSHOT, is to have something that patients can latch onto. As it'd be hard to advertise platelet-derived growth factors activated by platelet-rich fibrin matrix to rejuvenate vaginal tissue. I needed a name to indicate this procedure, and that trademark gives me a way of making sure that every quack on the planet doesn't start using the name to trick patients into having something bad done. The only bad thing I can find that ever happened from platelet-rich plasma was a person who died in China from using blood from a not FDA approved device, and so the patient became infected and died from sepsis. I do not want anything being put into a woman's body that doesn't come from a sterile device. And done by a person who is very well qualified. So if you look at the providers on this list, these are well qualified physicians. These are urologists, gynecologists, very passionate family practitioners who are involved with women's care in a very serious way, and all of whom I've talked to personally. These are all very well qualified family and sex educators, and so by keeping this as a quality website, it gives some patients reassurance. So that's all I have. Very grateful for you to be here. I hope that you'll become involved. Of course, if you're a physician on the call, you can go here, sign up, and after you do watch the videos, we talk on the phone, you take a written test, and I talk with you to make sure that that we're on the same wavelength and who you are, and that this is the right thing. And I feel comfortable in recommending people. This is not brain surgery where you need months of training. It is just an injection for which you don't even need a speculum, but you do need to understand where to put the injection. And anyone who's expert at doing a vaginal or a pelvic exam should be able to do this after a conversation and by studying very carefully the videos that we have. We also have hands-on trainings that are available. Um, and you're welcome to contact me about those as well. So thank you very much. This is Charles Reynolds, and I might have been the first to do this. Best I can tell, I was the first to put platelet-rich plasma in the vagina to help with sexual dysfunction and stress incontinence. But this is too big for me. I do not intend to, I don't even need to be the front person for this. I just need to be the one who champions it. But even that, I need leaders. I need sex educators who are leaders, men and women who can talk to different audiences. And I need physicians who are willing to take a lead and help as a group, the educators and the doctors, gather the data to prove this procedure, because this really is changing lives. Thank you very much for being here, and I hope to hear from you.